It happens to be the final day of Men's Health Month, but we hope this message resonates the whole year through. Guys, you are risking your health by avoiding doctor visits. Let's bring in Dr. Peter Bigler with Baylor St. Luke's Medical Group to find out what's going on with this. Welcome to Houston's Morning Show. Can you tell us what the biggest reason is that men often are known for avoiding those doctor visits?
Well, as I think of myself, Melissa, I think that I'm a human, and I unfortunately have fear of the unknown and fear of judgment. And I hope the clinic is a place where guys know that they're coming with their best interest in mind and when they're seeing me. And it's that fear of potentially bad news or the fear of the things I'm doing or not doing that may eventually lead to me realizing that I am mortal, potentially not a superhero.
It's so tough to talk about that. And again, I don't want to guy bash because I know it can be really hard for any of us to go to the doctor. Let's talk about another problem. We understand a lot of times men are very uncomfortable sometimes talking about their symptoms. They might be embarrassed to share. Does that become a barrier and a little bit of a communication problem with their doctor?
Yes, I agree. As patients come into the office, there is that desire to not burden, honestly, the physician with their symptoms and their fears, and or the embarrassment of potentially, if it's an issue with sexual health or an issue with their lifestyle that they feel like they're ashamed of or embarrassed by. The other thing is, oftentimes, we're asking patients to come into the office and potentially disrobe so we can do a skin check, and for a lot of gentlemen, they're fearful of that and embarrassed of that as well.
And I think it's important for them to realize that as a doctor's job, that's what you do. That's what you learn to do, right? So there's no need to have that shame. There's no need to be embarrassed because you guys have been trained to deal with things like that so they don't have to feel that way.
Correct. Our calling is to help patients, and we're not here to judge. It's a scenario that's common for us where the things that you, a patient, are telling to us that we're comfortable with, we're trained to deal with this. We're trained, honestly, to help you understand it and feel more comfortable with the issue that you're having.
And you mentioned this, but I'd like to talk a little more about it, and that is fearful of what you might find out. My goodness, my heart was feeling that way. What could possibly be wrong? And they don't want to know. Do you find that to be a pretty big problem?
Yeah, I agree. We're human again, and it's one of those things that it's the unknown that scares us oftentimes. But certainly, as a physician, I'm here to help you understand what it is that you may be facing, or to alleviate the unknown and provide information and knowledge that will allow you to be less fearful when you're in the clinic, or even when you're outside of the office and worried about a certain symptom that you're having that may or may not be meaningful or potentially worrisome.
Do you have a take-home message for guys about their health habits? I know you mentioned a lot of times they don't want to talk about it. They don't want anybody else to know something that might be habitual for them. What's some advice as far as that's concerned?
Well, I certainly would push, being a primary care physician, that all of our men are getting wellness visits and setting aside time, and we're forgetful. Certainly I am. And I would emphasize the importance of routine health maintenance visiting with your primary care physician to go through your personal history and your family history, and so that we can identify screening exams or potentially vaccines that you would need to help find a problem before it's a bigger problem or prevent a problem from happening. I think certainly a lot of us, especially as we get older, tend to neglect ourselves from a physical conditioning standpoint, and I encourage all my patients to shoot to get to 3 hours of exercise per week, and that threshold above which will help us keep us physically, mentally, and emotionally healthy.
All right, Dr. Bigler, glad we had this conversation. I know it's tough on guys to hear us, and I don't want them to think we're dissing them. We're encouraging them. Thank you for your time for Baylor St. Luke's this morning.
My pleasure. Thank you as well, Melissa.
All right.